welcome everybody. Welcome to our Make Digital Health Real session for July. We're just going to wait a couple more minutes to allow more people to join, and then we'll start the session. So it'd be great if you would pop in the chat, where you're from and the lands on which you are you're from. So if you could do that, that would be fantastic. And we will start in just a minute or so. All right, just a few more filing in. And I'll just let a few more in. Great to see some staff from the centre. All right. Okay, so we might start. So welcome to the Make Digital Health Real series for July. This monthly series aims to provide a space to discuss emerging research, share career insights, showcase projects, and provide a network for those interested in digital health. So my name's Cara Burns. I'm a qualitative researcher in the Digital Health for Litatron, the University of Melbourne's Health Tech Studio. And I have a growing expertise in environmental scanning for digital health, which is the topic of today's presentation. So to begin with, I would like to acknowledge and pay respects to the traditional owners of the lands on which our Health Tech Studio is located, the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging. We acknowledge that sovereignty was never ceded. I would also like to extend this respect to traditional owners of the lands from which our participants are joining us. For me, that's the Turrbal and the Yagara people of Meanjin in Brisbane. So, environmental scanning, which is the topic of today's presentation, has been widely used in health services delivery research and other related areas such as professional development and management practices. It originated in the disciplines of business and information sciences really in the 1960s. But today, environmental scanning has become a real integral part in strategic planning to identify trends and potential threats to inform decision-making and improve organisational performance. However, to date, there really has been a lack of guidance in how to plan and conduct an environmental scan, particularly in the literature, and inconsistency in how it's reported. So in this session, the conceptualization and development of RADAR-ES, which is a methodological framework for environmental scanning and health services delivery research, will be presented. The process and framework of RADAR-ES may serve then as a potential roadmap for developing approaches to research in digital health. So why is it important to digital health? Well, for most, and certainly the emerging digital health technologies that are around, we're not going to find all the information about features, acceptability, and implementation in the literature. The pace at which technology is developed and commercialised surpasses both research and regulation. As such, we as researchers and clinicians, we must combine data from multiple sources to develop a contextual understanding of digital health, knowing that this view is going to be partial, but also evolving. So this approach to gathering data and synthesizing data is really the essence of environmental scanning. For us as clinicians and researchers, we really do want to increase adoption of digital health, and we can do that through exploring data in other places like Reddit and other peer support communities. Data from these online forums, when combined with the literature, can provide great insight into how to implement technology with higher success. Similarly, things like text store ratings, lists of features, and community sentiment can provide ideas on which technologies might be relevant for which specific patient or population groups, and may even help us guide cultural adaptations, which are critical in our pursuit of digital health equity. So, having said that, it is now my pleasure to welcome Associate Professor Daniel Nagel from the University of Manitoba in Canada. Dan's current research is focused on innovative approaches to education for nursing students and interprofessional practice. He has a specific interest in experiential learning. His expertise includes qualitative and mixed methods approaches to health services research, systematic reviews, community health, working with at-risk populations, curriculum development, and of course, environmental scanning. So it is my great pleasure to hand over to Associate Professor Daniel Nagel, my friend, who will be speaking about RADAR ES, a methodological framework for environmental scanning in health services delivery research. Welcome.
Thank you very much for the introduction, and I'm just going to switch over to my slide here. Hopefully that pops up nicely, and it looks like it did.
It has.
Great. Thank you very much. So as Kara noted, my name is Dan, and I do go by Dan. I am a registered nurse by profession and did my PhD actually relatively late in life in 2017. Just trying to get my... And so for today's session, I will start out with our territorial acknowledgement for our area and do a little introduction of my background and my journey to where I am right now, and talk about overall how environmental scans are used in health services delivery and health service delivery research, and then talk just very briefly about the process that we use for the development of the methodological framework, and then introduce RADAR ES, which is the framework that we came up with environmental scans. And then I'll just share some lessons learned. And by all means, if you have any questions, please type them in the chat or even just raise your hand. I'll try and keep an eye on my screen over here. But I will try and leave some time at the end to answer questions as well. So my own personal traditional territories acknowledgement is really born out of my experience. In a moment, I'll show you where I've lived in Canada. Canada is a very diverse country, and all of North America at one time was known to the Indigenous peoples as Turtle Island. And so in Canada, we have about 650 different Indigenous communities, 50 nations or tribes here, and 50 surviving languages across the entire country. And of course, my background, where I've lived in Canada, I've had the privilege of working alongside Indigenous peoples and knowing them within our family from a very young age. And the one elder that I always tip my hat to is Sheila Couteau. She was a friend and a mentor for me. And when we were putting together an Allied and Safe Space program for Indigenous students in one of the universities that I worked in, she was our mentor and our elder for that particular group. But I also had a cousin who I didn't realize until later on in life, that she was a victim of the 60s scoop. So in the 60s and 70s in Canada, as part of assimilation, Indigenous children were apprehended from their parents and then adopted to white families across Canada and so forth. And in Canada, we actually have three main groups that are native to Canada. And so that is Indigenous, Inuit, and Métis peoples. And so literally, if you look at Canada and how big it is, I have practiced and or lived coast to coast to coast. And so really, I've had the privilege to live on, work on, and enjoy the ancestral lands of Indigenous, Inuit, and Métis peoples from coast to coast to coast on our part of Turtle Island. I am fifth generation descendant of white settlers, and I recognize the resources and opportunities I have benefited from to work at the University of Manitoba, that is located on the original lands of the Anishinaabe, Ininewak, Assinininewak, Dakota Ayeti, and the Denisolini peoples, and it is also the national homeland of the Red River Métis Nation. And if you look at the map where it has number 1, we have 11 signed treaties. The rest of Canada is not ceded territory whatsoever. And I'm in treaty number 1, which is right smack dab in the middle of the country. I acknowledge the harms and mistakes of the past and the impacts of colonization on Turtle Island. My personal commitment has always been and will continue to be to facilitate reconciliation and to promote collaboration, partnerships with Indigenous, Inuit, and Métis peoples and their communities in a good way. So I've had this incredible journey that I've been quite blessed with. I grew up as a farm boy on our prairies, and in those days, boy wasn't supposed to grow up to be a nurse, and somehow I did. And after about 20 years of practice, I actually ended up transitioning into teaching at a community college before going on to complete my PhD, and then moving into a tenure track position in 2 universities here in Canada. And along that journey, I had a lot of acute care experience, but I actually got into community fairly early in my career, about 5 years in, and worked mainly in community health centers, doing palliative care, home care, primary care, and ambulatory care. And during that time, we were actually starting to adopt technology within our community health centers. And the first digital things that we started to use, I mean, obviously computers, but it was starting to integrate medical records, electronic medical records, and also one of the systems for wound care, which was Pixelair. And then we started really branching out in that. And then as I went in to do my PhD, I actually, and I'll show a little bit more about that in a moment, my actual focus ended up on nursing use of telehealth technology. So that was kind of the basis for how I got into both environmental scans and being involved in research. And my background is primarily qualitative research. But also how I started being more involved research and technology end of things. Before I go on, I just want to recognize the core team, especially for the current manuscripts that are in review right now. And Dr. Rima Azar, Kara, of course, Pat Charlton, myself, and Terry Keane. And you'll notice that we actually represent a number of different universities here in Canada, and of course with Kara at the University of Melbourne. And then we actually had past contributing members to various projects along the way, and I'll introduce some of those because they really were the nuggets that got us started on this journey of looking at a methodological framework for environmental scans. So my own starting point was actually with my PhD dissertation, and my background was doing grounded theory. That was my huge mainstay. And I also had a very constructivist perspective. And I don't know what it's like there, but sometimes we find in our programs here that whole philosophical underpinnings for PhD seem to be eroding. And so anyway, I came out with a very strong grounding in looking at different paradigms and so forth in research, and came to grounded theory with a constructivist lens. And the question I went into my research was, how does the nurse come to know the person in a virtual environment? Because traditionally, nursing has always been bedside, hands-on, interactions directly with people. But of course, with the introduction of different telehealth technologies, nurses have had to adapt their way of engaging clients in the community. And we had always had this thing about caring as actually knowing the person in a holistic way. And so that was what my question was. And so I actually did a constructivist grounded theory that resulted in a theoretical model, getting a picture. And then the starting point for this actual project of ES is because when I was doing my PhD, I had to find where nurses were using telehealth technologies and what kinds they were using in order to be able to actually write my research protocol. So I had already started doing environmental scans and I had absolutely no clue of what I was doing. I kind of made it up. Then when we came to this bigger project with a bigger team, and we were looking at the complex medical health needs uh, of children with complex issues. And we had a very robust multi-method, mixed method approach to coming up with a model of delivery for that, of which part of it was actually doing environmental scans. And what we found out at the time is that there was no consistent definition for environmental scans, and there was no common approach or any kind of a methodology prescription for doing environmental scans. And yet, as Kara pointed out, in business and early technology, they were already using them, and so was education. And in the meantime, there's been a proliferation of environmental scans in health service delivery, but no real common ground on how to go about that. So in a way, this is how we identified a knowledge gap, and we started a process of looking at environmental scans. In the first phase, we did a scoping review protocol and then the scoping review itself. And those were published in 2019, 2021. And then we started to identify from the literature some of the things that existed or what was known about environmental scans, but we really didn't have any idea of how stakeholders, people who actually use them, felt about them and the barriers and challenges. So we actually did a study that was a survey, and we published those results in 2024. And then from that, we identified that people were looking for kind of a common definition and some kind of a recipe in how to approach environmental scans. So we did a Delphi study with, I believe it was 8 people completely finished the study and started to get some ideas around what was necessary for a conceptual definition of environmental scan in the context of health services delivery research, but then also what would be important to see in a methodological framework. And currently that article is in review. And then we went on to develop the framework over the last, I'm going to say 8 months. And it's currently in for review too. And today you're going to get an introduction to what that framework looks like. So starting out with an environmental scan, as I mentioned, there wasn't really any common definition. So we came up with a working definition at the end of the scoping review. And so our working definition was, within a health services delivery context, an environmental scan is a type of inquiry that involves the collection and synthesis of existing information and/or the pursuit of new evidence to inform decision-making and help shape future responses to existing and emerging policy, service delivery issues, and opportunities. And so we started to see the distinction that it is a type of research, but it's not like a primary study, although it could have elements of a primary study within it. And often the starting point was always existing information. So this was our working definition. And when we actually went out and asked stakeholders, how they viewed it, the critical thing that most people described it as was a snapshot in time. And so basically your data collection and the scope of the time in which you collect the information, that environmental scan, the scan of all the environments you're looking at, is really only capturing what exists in that particular moment. And so a lot of people used other analogies like a picture or whatever, and that became the in vivo code that we actually used for the title of the one survey that we did. And through our scoping reviews and also through the feedback from stakeholders, we brought together what are some of the main purposes that environmental scans are used for. And it was quite a range of different activities. And again, remember that this is all in the context of health service delivery. And so it can be anything about existing programs, services, and so forth, looking at needs, strengths, and barriers. So, some elements of it could resemble some of the tools that we use, like the SWOT analogy or technology in getting information and so forth. It could be looking at things around direct patient care, but it could also be looking at things around policy and best practices and new innovations and new technologies that are coming forth as well. And then through all of those activities that we did, we were looking at who was doing environmental scans. So different agencies. So we always think about it as being a pure research activity, but in many cases, it's done by frontline providers and first line managers who are out in the field in their different areas of health. And so, yes, there are academic researchers that do this. So we see a lot of publications through agencies, but there are also mechanisms here in Canada through our drug trials and whatnot, where it might actually be done through community or nonprofit organizations or other sectors out there. And some government departments also will commission environmental scans to inform their policy. So it by no means was purely an academic research activity. And then the different types of positions of people that were doing it, researchers kind of led the pack in statistics, but it was actually including practitioners, clinicians, managers on the front line, policymakers, research coordinators and research assistants, often either hired by researchers or even through government departments and so forth. And then also collaborators. So sometimes the people that provided us information were actually stakeholders that were involved in some way, shape, or form of environmental scans in their areas. And there is quite a variety of ways in which ESs have been used and the things that they've been used to study, but to improve things like vaccine rates. And of course, right now in Canada, we're becoming measles central after almost eradicating the disease. And of course, a lot of this is in relation to misinformation, disinformation that certainly started to surface over the COVID pandemic. Really looking at the use of technology in healthcare delivery. And so this is the natural way that we can think about it as it applies to digital health, because some of the things that they're looking at are the types of technologies that are being used to provide services, to support practice in clinical settings, and even the use of social media to get things like health promotion and health prevention messaging out. So it's actually used for a number of different ways, and very specific kinds of focuses when we were looking at the literature and how it was being used. But it is quite a useful way to harvest information, either on a very short term or even a long term, for health issues or concerns that arise spontaneously. So we saw a lot of things that were starting to surface around supporting long COVID, things around monkeypox outbreaks and so forth, that were really starting to be used to address urgent issues as they came up. And probably by far where we saw a lot of environmental scans being used was in the support in care for chronic disease management, whether it was providers or actually clients in community, and the same with mental health services as well. So in terms of looking at a methodological framework, the whole idea of what a methodological framework is to provide kind of a recipe, or in Merriam-Webster's words, a sequence of steps to complete a procedure. And there was actually a fairly recent article by Nicola McMeekin and her team. They actually did a scoping review to come up with a three-phase approach to develop methodological frameworks. And methodological frameworks are a little bit different than theoretical or other philosophical frameworks in that it's more of a how-to, but it should have some of the underpinnings on why we would do things and also the things that we should consider as we do them. So we use that, and our three-phase approach was number one, identifying evidence to inform a framework, then developing the framework, and then the third step would be evaluating and refining the framework. And I can only speak right now to 1 and 2 because until our publication comes out and there's time to actually use the framework, we can't move ahead to evaluate it and refine it. Now, at the very start of our journey, with the core team, and this was a couple of years before we started working with Kara, is that we actually started to come together looking at the scoping review, looking at all the data that we had. But what we wanted to do was set up some goals at the start of our journey. We certainly wanted to be evidence-informed approach. All of us are academics and academic researchers. We wanted to try and achieve whatever we published, this balance between an accessible guideline, so the recipe, if you will, and theory or theoretical underpinnings to kind of support the work that we did. And so, as you can imagine, that could be an entire chapter in a textbook. But we wanted it to be fairly accessible, published and in a journal that might be used by a blend of academics and clinicians and so forth. We also wanted to come up with a flexible framework that would be adaptable to different contexts. And so I think we have achieved that, and I'll explain that a little bit later on. And we always had this eye towards rigor. And so one of the things we had observed with many of the environmental scans that were published is that there was no reference to how they maintain credibility or dependability or trustworthiness in the terminology we use on the qualitative side of the house. And so there were no audit trails and so forth. So we felt very strongly that there needed to be some of these underpinnings also included in whatever we were going to render as a final product. Now, when we went through the first phase of McMeekin's framework for doing methodological frameworks, the first thing was really looking at what is the evidence that is out there. So we had done this scoping review protocol, the scoping review itself. And then we actually started doing some targeted lit searches, looking for frameworks that were existing out there, anything that described methods and procedures for environmental scans. And that initial search had to go into other areas that had already established, some of the early foundation to environmental scans. And then we also wanted to get some information from individuals with expertise. So the first thing we did was the stakeholder survey. And then the next thing that we did was the Delphi process. And all along, we either collaborated and consulted with people who'd already done it, environmental scans, and in some cases, they joined our team and so forth. But what we determined from phase 1 was that there needed to be a differentiation from an environmental scan as its own unique methodology that is different from all the other methodologies that are out there. So what we determined is that the main goal of an environmental scan is to assess current practices and trends to inform decision-making. And unlike primary studies, it does not necessarily produce new knowledge, although you can put components in to do exactly that. But what we wanted to very clearly articulate is it's not the same as the scoping review because you're looking at other forms of data that might be online that are not necessarily textual, because you might want to get an evaluation of existing services, and sometimes even reach out to people who are providing them to get their perspective on it. But at the same time, it isn't exactly qualitative research, and it's not exactly quantitative research either. It is a bit of a blend of the both, but it is not a true mixed method qualitative quantitative study, in the sense that you might have a literature review as part of it. You might even have a scoping review as part of it, and you may add on other studies to it. And we felt very strongly that if it's an environmental scan that is just a scoping review, then call it a scoping review, or call it a literature search and narrative analysis, or whatever, if there's simply one component to it. So the other piece that we determined is it is actually a multi-method inquiry comprised of 2 or more different data sources and at least 2 different data collection methods. And so we were seeing that it might start out with a literature search or a scoping review, and then there might be a survey of online information, and then there might also be interviews with stakeholders and so forth. So there can be a number of different data sources and a number of different data collection methods. And before we started phase 2, actually starting to put the framework together, we actually discussed a priori influences that would shape our work. So the first thing that we grappled with was our philosophical and theoretical perspectives on environmental scans. And of course, in the true philosophical senses, there are all of these paradigms, and some of them run on a continuum, and never shall more than one, be used at the same time. However, when we're thinking about what kinds of questions an environmental scan might take, there's a very pragmatic approach to answering that question. And so that whole idea of pragmatism, using what answers the question, should be at the forefront of this. And then the constructivism is really around social construction and how truth and reality plays out from multiple perspectives and so forth. And so if you're working with a team that is interpreting data and during the analysis, and if you're involving stakeholders and different pots of information, there is a natural tendency to co-construct stuff together. And so we actually see it that both of these principles can be applied to doing an environmental scan. And then we also had some guiding principles for an environmental scan framework. And so we thought about the ecological context, and we borrowed from Bronfenbrenner's ecological theory, which started out in childhood development, but has been adapted into business and education and many other realms, and including healthcare as well. And it looks at the micro, meso, macro environments around whatever context that you're looking at. And then the outside circle is the chronological, so the time period in which you're putting this you're doing your protocol, your planning and implementation, and then also your interpretation happens within that chronological period. Project timelines are a huge thing. They're usually driven by a number of things, not least of which might be the urgency in which environmental scans are done. And many people do these off the side of their desk, secondary to their managerial job in healthcare. And so project times are also a bit of a function between resource allocation and funding, of course. So that always has a bearing on it. And then there's this concept of knowledge users. And so knowledge users are typically the people, or at least this is the way that we've defined it, are typically the people is being generated for. And so how do you incorporate them, and how do you either bring them in potentially as stakeholders who are part of your team, or maybe they're going to be participants who will also help answer questions if you do a qualitative piece to it. And then the whole thing around rigor was really essential. So it's around doing things in an ethical way. So we incorporated ethical comportment, transparency, and the notion of rigor, which we use the qualitative terms of trustworthiness, authenticity, credibility, dependability, those kind of things, to actually guide every step of the way of planning and executing an environmental scan. So then we got right to the developing the framework, and there was tons of data to extract. And one of the things that had happened is, as we were starting to look at the data, our own early work, which were just the scoping review protocol and the scoping review itself, had already been cited in other studies 120 times, so within just a couple of years. And a lot of people were citing it as if it was the recipe and so forth. And so what we did is we started looking at all the articles that were citing our work and adding it to our scoping review that we had done before. Only this time we were definitely looking just at health services delivery research. And then we had to then start thinking about how do we analyze all of this data. And this is where the hard work of trying to put together a framework that made sense, that interfaced with what we knew from the other frameworks that were out there and the other descriptions of methodology. And so we started putting it all together in that way. And then when it came time to starting to organize those categories and whatnot, we used a team consensus. So there were 5 of us that, and we had started with an early framework, a very rudimentary one, and we started to refine it. And one of the things we know is that you want to come up with either a moniker or something that resonates with people. And of course, as a qualitative researcher, you tend to find things that become a bit of a metaphor in relation to the work that you're doing. So we ended up with radar, and there are other models out there called radar. So it's radar environmental scan, or ES, and it is comprised of 5 different phases. The first, recognizing the issue. The second, assessing factors for environmental scans. Developing an environmental scan protocol, no different than what you would do for most other research projects. And then how do you assemble the data and bring it together? And then reporting out the results. And so these were the 5 phases. And all of these phases were from an amalgamation or bringing together all of the pieces of the data that we had and all the articles that we had. And so it really truly was evidence informed. And as a researcher, I would say we probably used a little bit of constant comparison along the way, comparing what we were seeing across the different bodies of literature. So I'll just go through the phases fairly briefly, and then I want to leave some time for some discussion after the end of this. But the first phase, recognizing the issue, it's around clearly identifying what that issue is, determining the aim and the purpose of the overall environmental scan, similar to what you would do for any research study, develop objectives. And so your objectives and all of these should play off each other. And so you'll notice that in the diagram off to the right, that there is a bit of an iterative effect. And at the end of the day, you should have a research question to really help make it as focused as possible when you're going out to the field. And just about all of the articles, and certainly our own experience, was that this is very much a team process. So you really need to have a good team to start bringing these ideas together. And it's very iterative. And the way that we looked at micro, meso, and macro is micro was at the research team, the immediate area. Meso would be in the industry level within the health systems and so forth. Macro would be at the government level. where policies, legislation, and those kind of things are, and maybe some of the extant literature might reside out there. And of course, around this is the chronological layer that might be informed by something that's happening at the time. So if you can think of research and doing something like this during the time of COVID, the impact that those kind of events would have on one's research. And then the phase two is then looking at the factors that are going to influence how you will go about your environmental scan. So this is assessing the factors for your scan, or doing your kind of like a SWOT for your own scan. The first thing that you need to look at is who's out there that would be really great to have on the project team. And we looked at the different bits of literature. We definitely know that you need to have a good team leader who can keep the project together. You need to have different people with different sets of expertise. And as you're starting to think about, well, if you're going to do quantitative, for instance, well, you'd want to have somebody with quantitative analysis on your team. And then if you're doing qualitative stuff or scoping review or rich literature reviews, you definitely would want a librarian as part of helping you just determine your terms. And so we actually had access to a librarian for all of our activities that we did. And then look at the feasibility of the project. What are some of the barriers that you might encounter? Funding, of course, is just about always at the top of the list, followed usually by timelines. And so you do basically a pro and con list. You figure out what all your barriers. We actually recommend something like Lewin's force field analysis, actually, and just what are all the barriers and how can you mitigate some of those challenges that you identify to leverage them to make it happen, or make it happen on a reasonable timeline or a reasonable budget. And then developing the environmental scan protocol, which would be no different than any other research project that one would do. Determine your data sources, how you're going to get the information, and how you're going to organize your information. And as you're starting to think about this, you have to start thinking about whether or not you need to involve ethics in it. And if you do anything with some original research embedded within it, so you might be interviewing stakeholders, or you might be doing surveys and such, then you definitely will have to go through an REB, or Institutional Review Board process. So there are all kinds of data management systems out there that people are using. You have to kind of figure out which ones are the best fit with the multi-sources of data that you're using. And some platforms like NVivo, for instance, are pretty adaptable for even web-based information and digital information. And then, just as you would with any other research project, you go through the process of data analysis and how do you bring the pieces together. The only difference here is that it's truly a synthesis, in that you are going to be bringing in different data sources from different collection techniques, and how do you write it up in a way that you're going to be able to communicate it. So you're going to start bringing the data together. And then the verification part is something that if you do have stakeholders involved, then you will want to possibly bounce your findings off them to get a little bit of verification, or some people will call it triangulation to a certain degree, and get their feedback. And if you actually have some of those stakeholders on your team, they might be able to inform you as you're going through the process. And then the final part, just like any other research mechanism, is that you report out the findings. So this is the knowledge mobilization piece. But oftentimes, the reporting, if you're kind of commissioned by a health authority, hospital, or something like that, you may be restricted in how you share that information. And sometimes you have to think about this up front. If there's something that's publishable out of this, how do you navigate that if you're doing it for a very specific health authority? Because here in Canada, for sure, they don't want anything that's done on their time and reflecting them put out to the public without their knowledge and blessing. So you actually have to kind of think of these things up front. But then when it comes to reporting, is it a technical document or is it an actual academic publishable paper that might be the endpoint, or might it be more than that? And also then whether or not it would be, put on some other media platform through webinars or an academic article, academic conferences, those kind of things. So radar, ES, before I get into the lessons to share here, really it can be adapted to things like digital health, the things that the majority of you as the audience would possibly be looking at, comparing different technologies, delivery aspects and so forth. Or it might actually be a first step that you do before you do other kinds of development of technology and so forth. So an environmental scan can be useful in a lot of different ways. It can be a really sophisticated way of doing inventory of what is being done and where it's being done as well. But the things that came out of this was, the whole necessity is the mother of invention really suited how we came to this in identifying a gap that really has provided an opportunity for some of us in our programs of research to advance that, but then to even go out to create a whole new methodological framework. And we don't say it's the recipe, but it's something for people that are so starving out there for some guidance. And so that's where it came for us. But it does take a lot of dedicated time, input, and resources in order to do this. So as you can imagine, we started this process way back in 2017, 2016, 2017. And here we are finally, 7 years later, 8 years later, at a point where now we've put all the building blocks in place to create the radar, yes. And it also takes commitment too. So that core team, Kara just joined us since last fall, but the core team of us have been together right from the very beginning and very committed to this. And it is crucial to build a team whose members have a variety of strengths and to draw on expertise of stakeholders. So if you are doing an inventory of your team and think, well, you need this skill set, or maybe it would be really good to get a certain perspective, to try and get those people on the team from a very early stage and get them invested. In one of our papers, there were 7 universities involved, universities and hospital centers that were involved at one time. So it was very useful to get that. And then, as a matter of fact, one of them was Andrea Trico, who most people will know from the Prisma group. And then map out the project and mindfully build a solid foundation and put those blocks in place. So if you can think back to the project timeline that we had, if you know what you want to achieve, and if you're developing something like a methodological framework, chunk it out into pieces, doable pieces, get them covered off in order to move your project forward. And that's the end of the presentation. So if anybody has any